Hello guys, welcome back to Medical Coding Club. So today let us learn data and risk table in MDM. So before getting started with the video, as you all know that I will be conducting CPC revision classes on monthly basis and the classes will be on weekends. So the next CPC revision batch going to start from October 1st. Okay, if you are preparing for CPC exam or if you have any difficulties while preparing, so you can just enroll to my CPC revision classes. It's a 4-weekend online class and you will get to learn all the CPT chapter important concepts, and also rest I'm going to discuss the important things and I will provide you the material as well. Okay, the fees is 1800 only. So if you are interested, I will provide the contact number below. Please reach out to that number and get enrolled. So let's start with how to calculate data points in MDM table. In the previous video I already discussed how to calculate problem address, that is chart A. So today I'm going to teach chart B and chart C, data and risk. So in the data we have minimal, limited and moderate, and the highest level is extensive or high. So we have these 4 levels. Okay, so first we'll learn what is minimal or none. Okay, so in the minimal or none, you think like the provider is not performing any procedure or any labs like that, or if they are performing only one unit test, then you can just consider it as minimal. Okay, this is very easy. So the first level is minimal or none in the data section. So the next level in data is limited. So to code limited level, what we have to need, here you can see there are 2 categories in the limited level. Category 1 is regards to test and document, and category 2 is assessment requiring independent historian. Okay, first let us learn what is test and documents, category 1. And also if you see the guideline, they are asking or they are saying must meet a requirement of least one of the 2 categories. Either you have to get category 1 or either you have to meet category 2. So then you can take your data level as limited. So in the category 1, review of prior external notes. So if patient is having any medical record, that must be reviewed by the provider. This is also you can get taken as a each unique test. It's a unique source. And then so the next point is review of the result of each unique test or ordering of each unique test. So for example, provider has ordered one lab test and also provider has reviewed that lab test. In this case, you have to take any one point. Either you will consider this lab for ordering or you will take the lab point for reviewing. Okay, you cannot take both 2 points for single lab. Okay, lab test. And next category 2 is assessment requiring independent historian. So what is independent historian? Independent historian is nothing but someone should give the history of the patient. Like this should be other than patient. Okay, for example, parents, father or mother or spouse, okay, or guardian. So all we can consider as independent historian. So for example, provider is not doing any procedure, but if you got this historian point, then directly your data level will be limited. Okay, you can easily take your data as limited. So the next level is moderate level. Here we have 3 category, and if you meet any one of the category, then your level will be moderate level. So the first category is test and document or independent historian. So test and document is nothing but review of prior external notes and review of the result of the each unique test and ordering each unique test and assessment requiring an independent historian. Okay, the best example is you think like there is a one EMR, in that the historian point you got mother. Okay, maybe the baby mother is giving the history of the patient, and then provider has performed ordered chest x-ray. So ordering each unique test, you will get 1 point, and then provider has performed one lab test. Okay, so you got 3. Okay, in this you meet the category 1 now. Okay, then your level will be moderate. And the next category 2, which says independent interpretation of test. Okay, here the meaning is interpretation of test performed by another physician. Okay, this is the main thing here. The test interpretation should be given from other physician, not the physician who is treating the patient. Okay, the the point is the interpretation should given from other physician. Okay, then if you have that documentation, directly you can take your level as moderate. And the third thing, category 3, discussion of management or a test interpretation. So here in the category 3, discussion. Okay, this current physician who is treating the patient should discuss the actual problem with another external qualified physician. Okay, there will be a 2 physician involvement. They will discuss what's the thing or anything which is need to be done, or anything, any guidance, some clarification, and he is contacting the external physician. Okay, this documentation should be documented in the EMR. Okay, and then you directly you can go with the level moderate if the discussion has happened between physician of the current specialty and the external physician. Next, the last level is extensive or high. Okay, in the data table. So here the same thing, we have 3 categories, category 1, 2 and 3. But here the thing is, the guideline says we need 2 out of 3 category. Okay, while we discussing moderate data level, we wanted only 1 category to be met. Okay, but here in the extensive level we need 2 categories. Okay, for example, if you are getting 3 points from category 1, you got each unit test point, ordering point, okay, and interpretation point, I mean historian point, and then maybe you got independent interpretation of test also. So you met this 2 category, directly you can go with higher data level. Okay, I will add here, just have a look on this. The next component of MDM table is risk. Okay, in this risk we have 4 level: minimal, low, moderate and high. Okay, first we'll see what is minimal level. So here they define like minimal risk of morbidity. Okay, that means in the documentation you can see like take rest, or if you have a sore throat or something, they will just say gargle with the warm water. Or maybe if patient has came for suture removal, they might have removed the suture and they have given the bandages. Okay, and superficial dressing. So all this you can take your risk level as minimal. Okay, so next coming to low, here example, like if the provider is prescribing any over the counter drug, then your risk is low. Next risk level is moderate. Here we need prescription drug management to consider the level as moderate, or else decision regarding minor surgery with identified risk factor. Okay, they have found some risk factor and they are planning for minor surgery. And apart from this, decision regarding elective surgery, and the last thing is diagnosis or treatment significantly limited by social determinants of health. Okay, social determinants of health means what made the patient fall into sick. Okay, for example, unemployment or housing insecurity or food. Okay, so all this we can take it as social determinants of health. If anything documented, your level will be, you can take your level as moderate. So the next level in the risk table is high. Okay, to code high level, these are some instances: drug therapy requiring intensive monitoring or a toxicity, and then decision regarding elective surgery, major elective surgery with identified risk factor, or decision regarding emergency major surgery. Okay, and also if you don't have all this, but they are saying decision regarding hospitalization. Okay, maybe patient has admitted in outpatient setting, and now this outpatient provider recommending that please shift this patient to hospital, emergency department. Okay, then also your level you can take it as high. So these are the 4 levels which comes under risk. So yes, I have discussed problem addressed, like how to choose problem addressed level, how to choose appropriate data level, and how to choose appropriate risk level. Okay, I hope you all understood. And if you need in-depth knowledge, please do consider my CPC revision class and join to that class. I'm going to teach from the beginning, and I will give the example for each thing, and I'll make you understand well. Okay, and if you like this overview video, please do subscribe my channel and share with your friends. That's all. Thank you for watching.